Hello, my name is Dr. Gerald Chodak and this is prostatevideos.com. In this video, I want to talk about alternative and complementary and unconventional therapies for men that have prostate cancer. This is quite a controversial area. If you survey men with prostate cancer, nearly a third are taking supplements in some fashion. When you ask them why, most of them believe that it's going to help them with their cancer, it's going to help them live longer. The question then becomes, well, what are the facts? What do we really know? If you make a decision about taking a supplement or an herb or a vitamin based on a laboratory study or a study that's done in animals or an uncontrolled study that's done in humans, the truth is we cannot actually tell you if it works or not. And the facts about prostate cancer is there's never been good studies demonstrating that any of the supplements will help men with prostate cancer live longer or help them survive their cancer in a better way. So we have this limited information available. Now, having said that, there are some things that might be helpful. And if you're the kind of person who says, look, I understand the studies don't exist, I want to take some active role in what I do for my own health, here's a list of things that might be worth doing, and here's a list of things that don't make good sense. In my book, Winning the Battle Against Prostate Cancer, I've created a chapter that divides supplements, herbs, and vitamins into one of three categories. Category one are situations in which we have studies that demonstrate that something is safe and effective. And if anything is on that list, it's worth taking it. A second group are those things that have some suggested benefit, either from laboratory studies or animal studies, but there aren't good human studies to know one way or another if they are effective. There are, however, studies that would indicate it appears to be safe. Because let's face it, most people think that there's no risk to taking supplements. That's not true. Supplements can cause side effects on their own. They can interact with conventional medications you may be taking to make them either less effective or more harmful. And most doctors are not aware that you're taking your supplements and have an opportunity to counsel you about what's the best approach. So there is a downside to taking them. And if you want to be proactive, taking something that appears to be safe is in your best interest. The third group are agents that have neither shown good clinical effect in patients, but more importantly, have not been studied for their safety. And those I would discourage you from taking because they may actually cause you harm. And without knowing more about this safety information, it's not the smartest thing to do. So, it's understandable if you want to take a proactive approach, but be aware, just because someone tells you, oh, it helped me and I was doing very well, realize that without doing good studies, that statement may be greatly overstated and may be incorrect. And there's a downside to taking these things. In the end, hopefully you can find things that work for you in terms of their being safe, even if we don't know how effective they might be. Hopefully you'll find this information useful, and thank you for watching.